I'm Philip Patterson. I'm from Roanoke, Virginia, and I'm happy to be here at Lewis Gale. I'm an orthopedic surgeon who specializes in adult reconstruction. That's hip and knee replacements and complex revisions and people with issues with their hips or knees. I've been here in Roanoke and practicing in Roanoke for about 10 years. One of the procedures that I do that I really love to do are anterior hip replacements. I do anterior and posterior, and depending on the patient's anatomy, some patients would do better with the posterior, but the majority of what I do is an anterior approach. What I like about the anterior approach, it's been shown over time that what really allows the longevity of the prosthesis is the cup placement. And with the anterior approach, you can see your cup placement specifically using fluoroscopy, so that before you even leave the operating room, you have a sound understanding of exactly where that cup is and that it is placed correctly. The other thing that helps me sleep well at night, the fact that the posterior capsule, which is the weakest part of the capsule, remains completely unadulterated because everything comes in from the front. Therefore, the dislocation rate is 10 times lower on average based on the literature when you do the anterior approach versus the posterior approach. Amazingly, the recovery time with an anterior hip replacement is quite brief. I tell people to plan on about 6 weeks off of work. Not everybody needs 6 weeks. For most people, by the time you get to 6 weeks, you will feel much better off than you did before surgery.